I want to call forward Stephanie Winn, Camille Kiefel, Alisa Weaver, and David Reece. And so just like I endeavored to give the last panel, it seems like it got about 15-ish, 20 minutes given the questions. I'll do the same for the four of you, okay? And then I'm going to try to get as many members of the public up as we can, okay? Not that you're not part of the public. So whoever wants to go first, please proceed with your testimony.
Shall I? Okay. Good evening, Chair Nose, Vice Chairs Goodwin and Nelson, and members of the committee. My name is Stephanie Winn. I'm a licensed marriage and family therapist with 10 years of experience counseling a diverse array of individuals and families. I share in your goal of protecting gay, gender atypical, and otherwise vulnerable young people from abuses at the hands of professionals who are supposed to help them. But the current, as well as the proposed legislation, does not achieve its intended purpose. In fact, it does the opposite, creating medical malpractice victims and depriving families in crisis of proper care. Detransitioners are a uniquely traumatized and rapidly growing population with complex needs. One of their most common grievances is that when they initially sought counseling for their gender-related distress, no one questioned them. Mental health professionals simply affirmed their gender identity and ushered them along a path of social and medical transition without exploring their reasons for wanting to transition or properly assessing their psychiatric comorbidities, trauma history, family dynamics, or internalized homophobia, and how all of these might play a role. As a result of this negligence, detransitioners now suffer mental and physical anguish daily, including pelvic pain, surgical scar pain, vaginal atrophy, infertility, inability to orgasm, inability to breastfeed, urinary tract infections, metabolic and endocrine disruption, permanently altered voices, baldness, unwanted facial and body hair, osteoporosis, cardiovascular disorders, and early dementia. All of these ailments place them at increased risk of depression and suicide. These vulnerable patients were victims of therapists who neglected their duty to ask questions, evaluate comorbidities, encourage self-acceptance, and support healthy long-term decision-making. Now they need help for complex psychological and physical trauma, but have very little trust in doctors and therapists. The existing law, ORS 675.850, already makes it difficult for parents to find appropriate help for their children. Parents contact me in anguish, stating it's been impossible to find a therapist willing to explore the underlying reasons for their child's sudden transgender identification. Adolescent therapists are afraid to ask questions for fear of being seen as, quote, trying to change a patient's gender identity, which under the current legislation could be deemed so-called conversion therapy and therefore pose a threat to their license. Even though gender exploratory therapy, asking questions and getting to the root causes, has nothing to do with the abusive tactics of the 20th century that have long been banished from the counseling profession. The things on the Wikipedia page if you look at conversion therapy. The evidence-based approach of watchful waiting, which gives teens time to discover themselves without making life-altering decisions, results in desistance rates approximating 90%, as the process of going through puberty, coming to terms with one's sexuality, and finding one's place in society naturally resolves gender dysphoria in the vast majority of cases without any need for medical intervention. The proposed amendment would make this situation worse by depriving vulnerable adults as well as minors of comprehensive treatment for the underlying issues, such as, for example, sexual trauma, which can drive the desire to be rid of sexual body parts that are associated with that trauma for some people. This bill declares a state of emergency, but there is no emergency of so-called conversion therapy happening right now in the state of Oregon. And you'll be hard-pressed to find... Sorry.
You're doing all right.
Oregon's true emergency is the lack of proper exploratory therapy, which is not the same as the conversion therapy abuses of the 20th century. Proper exploratory therapy for distressed, vulnerable young people. This legislation will make that worse. Please vote no on House Bill 2458.
Okay. Whoever wants to go next.
Dear Chair Nose, Vice Chairs Goodwin and Nelson, and members of the committee. My name is Camille Kiefel, and we can all agree that conversion therapy that uses physical and emotional abuse is wrong. But what happens if you believe you're transgender because of trauma? What becomes a concern is the idea that any sort of exploration into trauma would be considered transphobic. I've come here today to share my story in hopes of preventing it from happening to others. In 6th grade, my best friend had been raped by her brother. I started to dress more masculine. Around 2010, I was presented with the idea that I could be non-binary in college. In 2016, I saw a therapist who affirmed my non-binary gender identity. In 2020, I saw 2 mental health professionals who signed off on a non-binary double mastectomy. What I needed was a therapist to tell me that there is no biological equivalent to a non-binary identity. What I needed was somebody to explore the discomfort with my breasts in relation to trauma, not to have them removed. I now live every day with a mutilated body because therapists affirmed my delusion. The reality is that therapists are working with an ideology that does not allow them to question gender identity, fearing that they'll be viewed as transphobic and engaging in conversion therapy. I've had 2 different therapists tell me, being gay is not a form of mental illness. Therefore, being non-binary is also not a form of mental illness. You must be non-binary. There's no biological equivalent to the non-binary gender in the human species. These therapists are not looking into disassociation from the body due to trauma. They're not thinking about this critically. I ask that you please don't pass the bill. Thank you for hearing what I have to say. I know you'll make the right decision.
Camille, thank you for your testimony. Who'd like to go next?
Chair Nose, Vice Chairs Goodwin and Nelson, and members of the committee. My name is Alisa Weaver, and I'm a licensed clinical social worker in the state of Oregon with 10 years' experience conducting psychotherapy. I would take no issue with this bill if it did not include language around gender identity. The portion I take issue with is, quote, providing professional services for the purpose of attempting to change a person's gender identity, including attempting to change behaviors or expressions of self. Helping clients change behaviors and expressions of self is the crux of effective psychotherapy, and I would argue that gender identity has no place in the definition of conversion therapy, at least for minors. I first learned about puberty blockers and medical gender transition of minors while working as a therapist in Las Vegas, Nevada. The dilemma that was immediately obvious to me was how to distinguish between those who will persist in a trans identity beyond adolescence and those who might be exploring a trans identity due to any number of complicating factors, including physical, emotional, or sexual abuse, poor self-image fueled or exacerbated by social media, sex-based bullying, digital or online exploitation, rejection of non-heteronormative expressions by family or peers, autism spectrum traits, eating disorders, etc. This dilemma does not seem so obvious to other mental and medical health professionals, unfortunately. I have heard many colleagues bemoan the harm of gatekeeping in reference to parameters that used to guide adult sex reassignment and treatment of gender dysphoria in youth. When it comes to minors, these safeguards make absolute sense to anyone who understands development. Adolescence is the search for a sense of self and personal identity through an intense exploration of personal values, beliefs, and goals. Complicating this process for Oregon youth, smartphones have become ubiquitous, and the negative impact on mental health that the social media era has ushered in for our youth has been well documented. Add to this 2 years of school lockdowns, unprecedented social unrest and isolation, natural disasters, and beyond unhealthy amounts of time spent online. Our kids have been through the ringer and continue to be bombarded with more information and messaging than any generation before them. They deserve the space and support to try and make sense of it all with compassionate and age-appropriate boundaries in place. The statute also requires that therapists employ gender identity neutral interventions, which I would argue should not include affirmation-only therapy, social transition, or any medical interventions for minors, as these honor only one aspect of that youth's identity at a particular moment in time and neglects the full process of self-discovery that individual is entitled to, in addition to creating a myriad of social and familial complications. The medical complications are not my area of expertise, but Finland, Sweden, and the UK all now agree that the benefits of puberty blockers and cross-sex hormones do not outweigh the harms and strongly discourage against giving these powerful drugs to youth. There is a growing army of detransitioned youth who have been harmed by gender medicine, many of whom continue to experience medical complications, including chronic pain, infertility, and in some cases, total loss of sexual function or enjoyment, to say nothing about the toll that betrayal by their helping professionals has had on their mental health. Evidence also suggests that girls suffer greater psychological harm from increased internet exposure. They make up the majority of delayed or rapid onset gender dysphoria cases, and they are more likely to suffer long-term harm and complications from hormone replacement therapy and surgical interventions. Clients and therapists deserve to have protections in place that allow both to commit fully to the process of psychotherapy, which is an ongoing conversation aimed at improving self-understanding and self-efficacy. While I deeply appreciate the goal of protecting vulnerable people from harm, as a social worker, this bill clearly falls short and has not protected detransitioned youth from harm at the hands of well-meaning professionals. Please do not pass this bill and draft another with more specific language that would outlaw harmful conversion therapy practices and allow all persons the freedom of patient self-discovery. Thank you for your attention.
Okay. Mr. Reece?
Chair Nose, Vice Chairs Goodwin and Nelson, committee members, thank you for your time today. My name is David Reece. I live in Jacksonville, Oregon. I wish we had more time for this discussion. I believe we need a more robust conversation on this bill outside of a hearing room. A one-sided approach to this issue is dangerous and will leave many people of all people groups uncared for, having trauma and pain unaddressed, all for the sake of blind affirmation. Affirmation of inborn LGBT identity as scientific fact is unfounded. In a study of several 100,000 people over 30 years, no gay gene was discovered, nor was a transgender gene discovered. Tacitly, sexuality has been determined to be fluid. A ban on talk therapy will remove valuable counseling resources from a very vulnerable population, as you've heard. Meanwhile, legislators toss around the term conversion therapy, an ill-defined term which is weaponized to remove the rights of consenting adults to pursue the life they desire. My questions surrounding this bill revolve around legality and constitutionality. Namely, should it be illegal for someone to pursue heterosexuality or realigning with their birth sex if they choose to within a counseling setting? Please consider the following. There have been numerous cases against therapy bans. All have been awarded in favor of free speech. In New York City, even LGBT activists urged city council members to remove the citywide conversion therapy ban because of fear of it being heard in the Supreme Court and being found to be in violation of First Amendment free speech protections. In Tampa, a federal judge struck the city's conversion therapy ban, upholding First Amendment rights to free speech. This decision was based heavily on similar decisions in Boca Raton and Palm Beach County, where therapy bans had been signed into law. In California, a statewide ban on conversion therapy under unlawful business practices was rescinded by its author and sponsor weeks after the SCOTUS decision on NIFLA versus Becerra. Why have there been no legal cases on conversion therapy in Oregon under current law? All of the professional licensing bodies which govern this area of interest have ethical standards of care which are followed by their licensees. Why have there been no complaints or action taken by any of these licensing bodies on this topic? Additionally, there have only been 19 cases regarding so-called conversion therapy in the United States which have ever been filed. Most of these cases were awarded in favor of free speech and counseling choice, or were dismissed before hearing on grounds of illegality or constitutional protection. And so, what is the urgency of this legislation? Enough to signal emergency? If the state can control free speech in a confidential counseling session with a licensed therapist, what other speech can it control? The LGBT community ought to be as concerned about this as I am. If the sponsors and supporters of this bill truly desire to care for the LGBTQ community, this is a reckless approach to doing so, which will leave many uncared for. If supporting legislators were truly willing to approach this topic with grace and compassion, more clear and definitive language would be ascribed to the term conversion therapy before any ban was placed on it. I implore you, please hear the opposition testimony today and hear that this bill will do unspeakable damage to those you are seeking to protect by its implementation. Please vote no on HB 2458. Thank you.
Okay. Committee, is there any questions that anybody has for members of this panel? Representative Javity.
Thank you. I wrote this one out, so I want to be careful. If you don't have the answer, I understand, but I would be interested if you do. Can you provide specific examples of practices or techniques used in conversion therapy that are not based on the assumption that being LGBTQ is a mental disorder, and that do not involve attempts to change or suppress one's sexual orientation or gender identity.
May I respond?
Whoever wants to take that answer, go ahead.
I think the whole problem is that those of us who are arguing in opposition of this bill don't actually believe that there is this quote unquote conversion therapy problem with regard to how we wish to be able to address gender questioning people. So the problem is that some people earlier today had the gall to link exploratory therapy in with conversion therapy. Now, as I mentioned earlier, if you look at the Wikipedia page for conversion therapy, you will read some horrific things that happened in the 20th century. So, for example, aversion therapy, it's not really therapy, but they used tactics such as forcing gay men to watch porn while simultaneously receiving electroshock treatments and taking nausea-inducing drugs. Okay, this is what we mean by abusive. Also on the conversion therapy list, you'll see Nazi human experimentation, and you'll see some very bizarre and unscientific approaches, such as a therapist that had a patient lay in his lap and hit a pillow with a tennis racket. Okay, these are not the things that we're actually contesting. I am not defending conversion therapy. What I'm arguing against is that this bill is very confusing, and it links the practice of exploring and asking questions with attempting to convert. So my point is that, you know, and I've read some emails that you've sent people, Rep. Nose, and I understand where you're coming from, and I'm actually really glad to be having, I'm so glad to be having this conversation with you, because I don't think it was ever your intention to prevent therapists from doing their jobs. I think, you know, if you think about a case of an adolescent who, you know, 3 months ago started saying I'm trans, right when all their friends did, and if you look at how much time they've been spending on TikTok and some of the messages that they were receiving around gender, would you say that every kid who ever does that should be on medication for the rest of their life and should have life-altering consequences because of a phase they went through when they were 15? I got a tattoo when I was 16 illegally, and that was painful enough to have removed in my 20s. I can hardly imagine what it's like to have to live your entire life with the results of a phase that you went through as a teenager when you were looking for a way to fit in or a way to explain your problems. So we just want to be able to do our job as therapists, which is to ask questions and explore the root causes. You know, as Camille has said, there was a link in her story between sexual trauma and the discomfort with her female body parts. For many people, it does have to do with homosexuality. And I've seen this of people who are uncomfortable with the fact that they're gay and they'd rather be trans because somehow that feels safer to them. We also know that there's a very high comorbidity rate with autism, with eating disorders, depression, anxiety, OCD, and that people who were adopted or in foster care, in other words, who have deep attachment trauma, are highly overrepresented in this population of trans-identifying youth. So we just want to be able to do our job as therapists, which is to do a comprehensive biopsychosocial assessment that takes the individual's entire history and environment and well-being into account, that also takes into account their developmental history and developmental trajectory and what we know about developmental psychology. And we want to be able to practice the basic tenets of person-centered therapy, which include, do you need me to wrap it up?
Because I got other questions.
Oh, sorry, okay.
It's okay. You're doing fine.
Let me just say that person-centered therapy requires that we be congruent, meaning that we're genuine with our clients. And if I can't tell my client, honestly, I see that you're a girl who really wants to be a boy, if I have to say, oh, yes, you are a boy, that's called affirmation therapy, then that erodes the foundation of trust and genuineness in the clinical relationship.
Okay. Do you have any follow-up to that?
No.
Okay. Representative Deal.
Thank you all for your testimony. Do you think there's a way to change Oregon law that would protect patients from harmful and unethical care and also allow thorough ethical care with clear guidance to therapists?
Whoever wants to answer.
Okay. Yeah, so I would be happy if the language around gender identity were simply removed, because the problem with this bill is that it links together sexual orientation and gender identity. Now, sexual orientation is pretty stable across the lifespan. The fact that people have gone to such extremes to try to abuse it out of people is just proof of how stubborn it really is and why it should be accepted. It also doesn't require society to change, or it doesn't require medical interventions. But gender identity is a highly fluid, novel concept that there's no biological evidence evidence for the existence of gender identity. And even the trans rights activists themselves cannot tell you whether it's something that's fixed or fluid. That's not something that there's agreement about in any community. So why should we medicalize? Why should we have just one path we push people down early in life? If we could just remove the part around gender identity, I'd be happy. I'd also be happy if there were more specific protections for therapists being able, as I said, to ask questions, because I don't think it was ever your intention to put these parents in this situation that I've seen where they can't find any therapists who are willing to ask questions. So I would be happy to work with you on some more protections for exploratory therapy.
Okay.
Could I say something?
And
Yeah.
then I'm gonna try to get some folks from the audience who want to testify.
Sure. So I guess the only other thing I would say is that, I guess specify blatant physical and emotional abuse, because we can all agree on that, and that's wrong. Because I have to live with this for the rest of my life. So it's, and I can't fit a dress the same way again. I can't breastfeed. I just don't want this to happen to somebody else. So, and I was an adult when I transitioned, so this bill would have impacted me, or it would impact somebody like me as well.